not sure if I've got it right because my internet, is it this one, yours?
Yeah.
Okay, so it's going to be presented by Besher atrar, if is here or online, okay. And the title is, okay, sorry, Organ Donation in KCA COVID-19 Pandemic. Please. Can you hear us?
I'm pleased to present the organ donation and transplantation in Saudi Arabia during COVID-19 pandemic. As disclosure, I have nothing to declare, and I'm presenting this data on behalf of the Saudi Center for Organ Transplantation, which is the governmental institution supervising all activity related to organ donation and transplantation in the country. So here is the timeline on the occurrence of and the effect of COVID-19 pandemic in Saudi Arabia. As many of other European and in the region country, the first case were recorded in our country in March 2nd, and within a less than 2 weeks period, an implementation of 24-hour lockdown and suspension of operation nationwide, including the essential sector. So in March 15, we suspend the activity of living donation and transplantation activity in all accredited transplant center, and the first position statement came out on March 23, released to all transplant center on how to approach the cases and to test the all donor and recipient with the COVID-19. So over the period of March till October, almost all living transplantation were suspended, and we only continue with some deceased organ transplantation with the most active center in just a few cases. So Saudi Arabia has a proactive approach regarding the COVID-19 disease. We have a daily update provided via various social media platforms, and we're censoring the number of cases at daily basis about per region, according to the 20 region, number of cases, and the most important for us is the number of ICU. And during the 6 months over the year 20, almost 60 to 70% resources of our ICU were occupied by the pandemic COVID-19. And here the position statement on organ transplant and donation during COVID-19 pandemic. We have obligatory that any potential donor, deceased donor, should be tested with the PCR from lower respiratory sample, alveolar lavage or tracheal aspirate, and even if when it's negative, we have to have a risk assessment. If low risk, we proceed. If high risk, to repeat the test to assure it's negative before to have the transplantation. The same for our recipient. It should be tested, screened, and in case of negative, with no contact, no risk that we may proceed, and once it's confirmed that it should be repeated and tested after 4 days in order to get the approval to get the transplant. Here is the outcome on the year 2020 compared with the previous year, and you can see in the deceased donation, the number of reported cases decreased from 585 to 408 for the whole year, with the around 20% of the decrease of the reported cases, which affect the number of eligible donors decreased from 354 to 230, and this affect the number of consent and actual cases were decreased from 114 cases in the year 2019 to 65 only recovered cases in the year 20. And this affect the number of deceased organ transplantation during the year 2020. We have a total of 72 deceased kidney transplantation compared to 140, almost 50% in kidney, liver, 50 liver compared to 78, 28 heart compared to 46 in the previous year, and 50% decrease in the lung transplantation, 35 compared to 70 in the year 2019. And here is the comparison and organ utilization and tissue recovery from deceased donor. Almost this total of organ transplanted from deceased donor were 188 compared to 343 in the previous year. But at the same time, we have the same degree of decrease in the living transplanted activity, almost by 45% decrease compared with the year 2019. In conclusion, ladies and gentlemen, the significant decrease in the number of organ donation and transplantation activity recorded in the year 2020, but at the same time, the safety measures were taken through the recommendation and guidelines provided by the Saudi Center